So my name is Julie Barber. I am originally from Westerly, Rhode Island. I graduated from URI in 2013. In high school, I knew that I wanted to do pharmacy, so I applied to a lot of schools in the area. And being from Rhode Island, it kind of just financially made sense to go to URI. And then in hindsight, like, it was the best decision I ever made. I think I didn't realize like how good I had it to be lucky to be from Rhode Island and have this be our state school. So I think like many people in Rhode Island, I felt like I wanted to go somewhere more fun than my hometown, and I'm so glad that I went to URI. It was the best experience that I ever had.
Yeah, I've actually had very similar conversations with other pharmacists in the past couple of days while doing these interviews, because I'm also from Rhode Island. I'm from Narragansett, so I'm right here. Like, I'm in the college backyard, basically. So everybody in my high school was like, yeah, no, I don't really want to go to URI. I want to go somewhere different. And I was like, yeah, well, it's a good school, so I'm going to go there.
Right, yeah.
Yeah.
Anyway, yeah, I feel like we don't, then especially now, I've been out a few years and I precept at work. And so I've been able to see a lot of other students from different universities, and I really do notice the difference. The students that we have from URI are really well prepared to come out onto rotation and graduation compared to other schools.
Yeah, they do a really good job. So where do you currently work, and what's your current title?
Sure. So I'm a clinical pharmacist at the Westerly Hospital in Westerly, Rhode Island. And so I've actually worked here in college as well. So we've had a lot of growth in the past 10 years or so. Originally, we were just a small community hospital. A few years after I started working here, we were acquired by Lawrence Memorial Hospital. And within the past few years, we've joined the Yale New Haven health system, which has been really the best thing that's happened to us and the community, to have all those resources and services available to both the community and to us as a department. It's just totally invaluable. So we really enjoy working with and to be part of Yale. It's really great.
Yeah, that's awesome. So what does a typical day look like for you at work?
I think the thing I like the most about my job right now is that every day is really different. So the nice part about working in a small community hospital is that you can't really get stuck into one niche because there's just so many things to do and not a lot of people. So like today, I was in the Coumadin clinic. So we have patients that come in, we stick their finger, we get their INR, and we tell them what to take. So it's really direct patient care. You find that they ask us a lot of other questions that don't even have to do with their warfarin, so you feel really involved in the medical care. So I like that. I also sometimes work in the central pharmacy, so that's doing a lot of operations business. So you check IVs, you check all the drugs that are going out of the pharmacy, you do a lot of stuff for the outpatient areas, and then we also have roles that are more clinical services. So you're the clinical pharmacist for our inpatient units, or also the intensive care unit in the ER. So every day is different, and I really like that. I think the most. It's I get to do a lot and see a lot. It's really nice.
Yeah, so that kind of leads me to my next question of why did you want to pursue a career in hospital as opposed to, long-term care, community, or something different like that?
Sure. So I was in high school. I think I knew I wanted to do healthcare, but wasn't quite sure. And I spent some time working at an independent pharmacy here in Westerly, a community pharmacy, and I was terrible at it, and I knew I would hate it, and I couldn't do it. And so they had a job here at the Westerly Hospital for a student intern. So I was like, oh, I'll try that. And I just loved it. And I've been here all along. It's been wonderful.
That's great. So do you respond to codes at all in the hospital? And what is that like if you do?
Yeah, so we do. The pharmacist is part of the code team here at Westerly. COVID has obviously changed that. So pre-COVID, we were right in the room at the bedside mixing meds and really part of the team. With COVID, it's kind of changed as we've learned more. But when COVID first happened, pharmacists were kind of banned from going into any unit just because we didn't know a lot, and there really was a PPE shortage, and there almost is not a pharmacist shortage, but there's really not a lot of us, so they really couldn't expose us in that way. So now we spend most of the time outside of the room, but you really are part of the team when it comes to preparing medications, making recommendations, making sure that we're staying on the ACLS protocol and that we're not behind on an epi or is it time to try something else. So you're really involved, and that's a piece that I really like because you're right there and you're right at the bedside.
Yeah, that's great. How do you feel like URI prepared you for this role?
I think URI does a really good job of teaching you to be part of the team. So certainly there's layers and hierarchy in healthcare, but I think they really teach you to respect that you're the medication expert, and there's people on the team who are going to be looking to you for these answers. And so it's taught you to work really well with nurses and doctors and nurse practitioners and all the members of the healthcare team to really have a collaborative practice. And I think they also drill down the clinical aspect of the job, so that you're going to be asked really difficult questions, and either they teach you to know what those answers are, or they teach you how to find it pretty quickly. So I think they prepare you for all aspects of the job really well.
Yeah, definitely. And I can't remember if you said it already, but did you do a residency program or no?
I did not. So I went through the process, and I did match, and then I went through the scramble, and I didn't match there. And then I was able, through connections I had made through school, to get a job in a hospital in North Providence when I first graduated. And I also I had a per diem job at another hospital, and I kind of just kept in touch with my friends at Westerly. And then when the job came up, I came back. So it definitely was a non-traditional path, but I wouldn't change it for the world. And I actually took my BCPS this year. So having not done a residency, you have to wait a little bit longer, so I did that this year. So, that kind of felt nice to do, having not done a residency.
Yeah, that's great, and that's really nice for me to hear as a P4, because I'm, looking at jobs right now, and I'm trying to figure out what's going on, and it's just nice to know that it does work out no matter what. So
it does. Yeah, I always tell the students I have coming through here that residencies are great, but basically, that there can be plan A, but there should also be plan B and plan C. And just because something doesn't go one way doesn't mean you'll never get a job in a hospital. And, it feels like the end of the world, but, it's not. Everything happens for a reason. It works out. No one wants to hear that when you're in the moment, but it really is true.
So looking forward, how do you see the role of the hospital pharmacist kind of evolving in the future?
Yeah, I think it continues to get more specialized as it goes on. So especially larger institutions, especially like your tertiary medical center, you're much more specialized, which some people really like that. They want to, do cardiology and do that all day. So I think it's only going to get more, as patients get more complicated and as medical therapy gets more complicated, pharmacists have to become more specialized. So I see a lot of people getting specialized in that way. But also, COVID, I think, really changed healthcare, and it showed that a lot of people can step up and do things they weren't doing before. So we've seen pharmacists really take over the vaccination efforts, and even in the Yale New Haven health system, as they had to divert some of the nursing staff into other areas. I know pharmacists, especially in New Haven, took over a lot of ambulatory responsibilities because they had to move staff around. So I think, it's tough to predict the future, but I think it will only continue to change. And I think URI really teaches students to be able to, change on a dime and do new things and learn new things. So I think kids coming out from URI will be fine no matter, what direction it moves in.
Yeah, I agree. So was there anything else you wanted to share? I asked all the questions that I had prepared. Anything else? Yep.
Yeah, I mean, I just feel like I can't recommend it enough. Like, I was one of those kids that wanted to go to a big city or a big name school, and going to URI, it was the best thing that ever happened to me. And I wouldn't be where I am today if I didn't go to URI, and I wouldn't want to be anywhere else. So can't more highly recommend it.
I feel the same way.